So thank you for your presence here. Thank you for the opportunity to talk with you about our experiences using data science with R and transform some of our findings in maps. Okay. What we do, what do we exactly do? I work as a technical advisor for the Vice-Presidency of Brazil, of the Republic. And since a few years ago, I've been working in data science teams. And what do you do in these activities? We analyze data from a lot of issues, a lot of public policies like health, like education, climate changing, economics mainly. And then using R, using statistics techniques, just like clustering, centrality, and key query state tests, for example, we discover some patterns, okay? I use it to talk patterns, but I discovered that's not patterns, it's pronounced just now, and I didn't practice yet. And so we realized that maybe using maps for displaying the results of our finds was sometimes, in many moments, a little better to explain and to even influence public policies decisions, okay? And so we use this package geobr. Who works with R here? Anyone? You two of us? GeoBr is a package developed by IPEA, is an institute in Brazil that is focused on economy, and they developed this package that delivers shapefiles from Brazilian cities, Brazilian states, Brazilian regions, Brazilian biomes, and so on, okay? And also we use spdata as a resource to display world map, okay? And also we use all the stuff related to statistics, packages like PAN, that is used to build clustering, and so on. So we found the patterns. We decided that some patterns are good to visualize as a map, and we go on. Just some words, we use open data source. These open data sources are available from open data portals. In Brazil, we have some open data portals, but also we use open data available from NGOs and even from private companies. Let's begin with this set of maps. Our question here is, what happened in cities where we found out that there is little or even zero expense, zero money put in hospitals in the cities? In Brazil, we have some laws that address the municipalities to spend a portion of their money, their tax, in health. But not all this money goes to hospitals. There is a system of health in Brazil, SUS, where they give responsibilities, different responsibilities to the municipalities, to the state, and even to the federal government. And so, when we observe the data, we can see that a lot of municipalities in Brazil, they don't have hospitals at all, okay? These cities are almost all of the cities are cities with little capacity, little influence, little power of making public policies. We used here a hierarchy, a framework developed by IBGE. This is a statistical agency in Brazil. IBGE, they divided the Brazilian cities in 11 levels. This first one here, just here, is the level with São Paulo. This is the biggest city in Brazil, the most powerful city in Brazil that have more capacities. And to the right and to the bottom, the capacity of the municipalities are decreased. So we have here, in this map, the so-called centro local. These are municipalities with very, very poor possibilities of doing public policies. There are more than 2,000 cities in this scenario here. And we can see this dot in red, and we can see the legend here. And we compare the legend with the dots, we can visualize that in many of the cities, about 100% of the patients have to travel to other cities in order to be attended in hospitals, okay? So this is our find. And the other side of the coin, is there this phrase in English? Oh yes, the other side of the coin is that some municipalities receives a lot of patients from other cities. This is just the case of Recife. Recife is the city in Brazil that most receive patients from other cities. Okay, we can see here these colors. The redder is the color, the longer is the distance traveled by the patients. We can see here some cities that are over 4,000 kilometers from Recife, so they have to travel. I don't know why they have to travel to Recife, but this is a fact that we found in our data. This data is a sample of 1 million attendance realized in Brazil in 2001. This is a sample of about 10% of the total population of hospitalizations in Brazil in that year. So this is the map on the left, and the right, we can see that there is agglomeration here near Recife. This is the cities that most send patients to Recife. And this is so interesting finding that a great group of journalism here in Brazil, Rede Globo, used our data to investigate what's the phenomenon behind this behavior here, okay? And they found out that some mayors don't spend money in hospitalization, but they spend money in ambulance to take their patients, their citizens, to Recife in order to be attended there. And it's also interesting, a big hospital here in Brazil, Hospital Sírio-Libanês, they use our data to train their people who works with SUS, with our system of health. They use this data to train their people. So I think that this is a great outcome of our work. Now we change the subject. We are going to see that I'm going to change the subject a lot. It's like the party yesterday. We were drinking sometimes cachaça and sometimes beer, and now we're going to travel around a lot of times. And now we are comparing the evolution of HDI in Brazil. We used clustering techniques to separate the cities in 3 groups. The first group here are the cities that had low development, low movement, low shifting from 2000 to 2010. And we can see a region pattern here. The cities are mostly in the south and southeast of Brazil. These cities are just cities that historically are richer, have more good conditions, offers good conditions to their citizens. So they didn't increase a lot in their HDI index. These cities here are the medium cities, the medium shift, but in this third map here, we see the cities that had a high development in their index. We can see again that here we have a regional pattern. We have cities in northeast and north of Minas Gerais. They come from red dots. Here in my presentation, we can see vividly the red dots, but here, unfortunately, not. But these are cities where we faced a lot of low HDI index, and they changed in 2010 to blue or white, indicating they shifted to a more reasonable situation. Okay. This is another picture where we can see very clear what happened in Brazil in these 20 years. Unfortunately, again, consider that this is very red dots. Here in my presentation is very red, and here we can see a lot of points that are very blue. So this indicated that there was a great shift in poverty and hunger in Brazil. We improved a lot in these years, thanks to a lot of public policies related to diminish the inequalities in Brazil, and also for the democratization and a lot of other aspects that we historically know in Brazil. Again, this data and these maps attracted the attention of newspapers, and a journalist in Ceará, she asked me to draw and to make some analysis just for the state of Ceará. Ceará is a state in northeast of Brazil. This is now it's not so poor, but 1991 was a very poor state. I was born in this state. I was born in this city here, Fortaleza. This is the capital of Ceará. So again, we shift for a state where all the shape of the municipalities are in red shades, to another picture where we can see that there is no more municipality in low level of HDI. Again, a great shift. In Ceará and northeast of Brazil were the regions where we most faced a great improvement in social conditions. Now, we change the subject again. Now we're going to talk about climate change, about droughts and floods. Here we can see the evolution of cities that faced droughts from 2013 to 2023. We can see here in this first map that the dots painted in red, the municipalities painted in red, are mostly exclusively in northeast region and in north of Minas Gerais. This is what we expect. Since we know our country, this is just what we expect. We expect droughts in these cities. But the things changed through the years, and in 2023, we can see that a lot of cities in legal Amazon and in the state of Rio Grande do Sul are also facing droughts, mainly because of natural phenomena like El Niño, La Niña, and also for climate change. So this is not a situation we want to see. But unfortunately, in 2024, these things happen again, mainly in legal Amazon. A lot of cities faced a very heavy drought in this year, unfortunately. And when we focus just in legal Amazon, we can see these two maps here. On the left, 2013, we see that this bluish these blue shapes here are the cities that faced flood. This is just what we expect in legal Amazon. We expect flood. It's a part of the ecosystem. Right? It's a part of the traditional season, okay? But in 2023, the things changed a lot, and the blue shifted to yellow, indicating droughts in the cities, okay? When we go to Rio Grande do Sul, the things are much worse. We can see that in 2013, there was just a few cities that faced some kind of disaster or drought or flood. But when we analyze 2023, you can see that almost all the state is painted in one of these three colors here. We saw in 2013, all the cities here painted in yellow, indicating droughts. We saw these cities here in purple, indicating storm with intense rains, okay? But most concerning is this cities painted in red that faced both droughts and flood in 2023. And we know what just happened this year in Rio Grande do Sul, where almost all the state was underwater, heavy rain. Okay, so these maps were used in some reports that we prepared to the Vice President, but all these maps were also used by a podcast that discuss technology, technocracy, and they used these maps in their audios, visualizations. Now we change the subject again. We are going to talk about residents without bathrooms. This is a box plot, and we can see the distribution of the proportion of residents with bathroom. We can see here that there is a high level of proportion, the median and the third and the quarters, the first quarter and the third quarters are very in a high level, but unfortunately we see a lot of cities that are outliers with low level of presence of bathrooms in the residence, with low level of proportions of residents with bathroom. And then what we've done, I transposed those data to maps, and again, we can see a regional pattern. We see that northeast and north of Brazil concentrate the cities that has low proportion of bathrooms in their residence. And again, so a map helps us to focalize where the problems are happening in Brazil. Now we change the subject again. Now we're going to talk about HDI again in climate change, both together. We can see in this map the changing of position of HDI, in the rank of HDI when it's considered the planetary pressure. So there is a pattern here. The colors here are not so good, but consider that this is very red. Here também is very red. Here, indicating that these countries falls a lot in their rank when it's considered their pressure to the climate. They come from these countries. Canada falls 40 position. Qatar falls 103 position. On the other hand, Brazil claims 7th position, and Argentina claims 17 positions. So I think it's a good source for discussing the climate change in COP30 next year, to put the responsibilities in the right people. Finally, there is this map here. This is a map that has a peculiar situation. It's a pride map for me because the Vice President of Brazil, Geraldo Alckmin, handed one print version of this map to Nobel winner, Steady Flow, Nobel winner of economics. And this map indicates the transition of GDP share from 1960 to 23. We can see here that Brazil expand their, there is expansion in the GDP share from 33% to almost 50%, and a fall in Argentina from 25% to 15%, and mainly in Venezuela from 12.6 to just 2.6, okay? So this is the map that our Vice President delivered to the Nobel Premium. So that was my pride moment in this year. So this is just come to the final of my presentation. These maps here I use it in storytelling, I use in dashboards, and also use it in internal use by government institutions. We want to promote transparency and collaboration. Many of these maps, the code that generate these maps are available on GitHub or GIST. We intend to make these maps also to inspire broad adoption. In fact, a lot of government agents, they come to us and help and ask us to help them to develop this approach also. Okay, so that's it. Thank you. This is my name. This is where I work. My email, my Telegram, and my LinkedIn. I guess I don't know if we have time for questions. If it's the case, I am here to answer, and if not, I will be happy to answer your questions using one of this form here. Thank you very much.